So, well, welcome to this talk. I'm John Campbell, as you probably know, and we're talking to Dr. Sohail Bhatti, who has recently won the Gibraltar Medallion of Honour for his services as a head of public health in Gibraltar over is it a 3-year period, Sohail, you did that for?
Yes, I was in a fixed term contract. It was originally for a year and then they extended it. So I did 3 years in total.
It's always nice if you get kept on. That's always a good sign if you got an extra 2 years. And you're currently you're a locum now, but you're a locum consultant now, but you're actually interim head of public health for Slough, which of course is an interesting part of England as well.
Indeed.
And you were also founding head of the postgraduate medical school in the University of Gibraltar.
Yes, it was an opportunity. So not having enough to do to fight COVID, I was endeavouring to do. There's a nascent new university in Gibraltar, and like a lot of communities that are isolated, they wish to do as many things as they can locally because it keeps your young people with you. And I mean, there's no way we could do a medical school, but postgraduate medical school in terms of driving up the quality of standards in education is always something everyone aspires to, I think.
So before we get on to Gibraltar, it sounds like you've got a background in medicine and public health here. Do you want to tell us a bit about your working life, if you'd like to?
Sure. I mean, I graduated in Glasgow and I went to medical school there, did a few house jobs, and then ended up training in public health in Manchester in the northwest. And I've spent about 30 years before I got to Gibraltar, doing various jobs, mainly in the north and the northwest. When public health went into local authorities, I took the opportunity to help a lot of local authorities make the transition. They often hit problems relating to confusion. I think there were value confusions more than anything else. Didn't understand why people who are really proud of their NHS work would suddenly resist wanting to come into local authorities. So there was mutual incomprehension. I flew in. So I ended up being a director of public health interim in places as disparate as the city of Bristol, the city of London, and I worked in Newcastle, North Yorkshire, Staffordshire as well. So I've had a broad range of public health experiences. The job came up in Gibraltar, and it was being advertised as a fixed term appointment. I went there for a year. We had a chat. It was a little bit far away than the normal run-of-the-mill things, and they obviously, I think they took a shine to me and said, we'd like you to do more. And so I got an extra 2 years out of it, and just smack bang in the middle of that second year, along came this strange disease that was what I had been training for actually for 30 years. So that was part and parcel of what you do in public health. I went into public health. A lot of things and specialties become specialized. So whilst it was generic public health training, now people train as communicable disease control consultants, consultants in other epidemiology. But I broad training, and so whilst I had never been a consultant in communicable disease, I rose to the challenge which I had been trained for. So I count myself blessed that I was able to help the people of Gibraltar, world more widely, that before it came for retirement. So I think it a great blessing that I was able to do something that was the penultimate crowning glory of my career, if you like.
So it's almost as if your whole career really was looking forward to January 2020 for this. You're in the right place at the right time to handle this pandemic.
Absolutely.
When was the first time you heard of the coronavirus? I obviously had heard of coronaviruses before, but this particular pandemic, coronavirus, when was the first time?
So I think I actually picked up some reports that were coming in early January from a place like Wuhan. I've got to say, like a lot of people in the West, I had no idea where Wuhan was, and you know, I thought Wuhan, China, where could that be? In fact, we had a meeting to review the priority to be given to different challenges to the place of Gibraltar, just like there's a national risk register in most jurisdictions, including the UK. They had flu pandemic at the top, and they asked me, so colleagues asked me, should we still be, surely terrorism is worse than that? And I said, well, you know, I tend to disagree, and there are very good reasons why it's there. And actually, on the back of that, the Civil Contingencies Coordinator said we would do an emergency planning exercise, maybe a tabletop exercise, just so we can exercise that bit of it. So we went through an exercise where we thought that there may be a virus such as Ebola on a ship, because Gibraltar's a port. You know, that's one of the attractions of Gibraltar, why it was a military base in the first place. So we went through that exercise in the hospital. Gibraltar only has one hospital, and therefore, unlike in the UK, there is no sort of reciprocal arrangement with backfill. If your hospital becomes full, you can revert to another. We didn't have any of that, and that came through. If we did have a major crisis, we would have to try to keep the hospital open for emergencies, because there was very little alternative provision. And at that time, this would be a week later from early January, there were more reports coming in from Wuhan. And I remember saying to the Civil Contingencies Coordinator, Ivor Lopez, I said, look, maybe things, we might need to escalate it to a broader tabletop exercise involving lots of emergency services, which we did do. It was opened by the then Minister of Health, and we had all the emergency services there, the ambulance service, the police services, we had the hospital, obviously, and I mean, basically, we came to the conclusion that if it were to come into Gibraltar, we would be stuffed, because it was just so large a challenge, given the volumes, that actually everyone looked towards the hospital to address it, and the hospital sitting very far away from everywhere else without any support would struggle very rapidly. I remember doing the opening speech there and saying, look, it looks like there are now 11 people dead and 200 people that have fallen ill, and I've got a bad feeling that, you know, the exponential curve means it is rising rapidly. And at that point, there had been reports of cases in Thailand and other places. So I said, it looks like it's gotten out. So it strikes me as being somewhat dangerous, and we should consider it. And as it then happened, there were cases being reported in Italy, North Italy, and people started to report them also in Spain, central Spain, and London. So I think the advantage that I've got in Gibraltar was that I've got a polyglottic population. People speak, very few people only speak one language. Most can speak in Spanish and English, which are the two main international languages. A great asset for those people. And they could watch a bit of Italian as well. So what happened was that people became more alarmed. But like, I suppose, in the UK, there was a sense that it couldn't happen in Gibraltar. It was so far out of the way that nothing could happen. And we actually did then consider, what would we do? We said, so Gibraltar works on tourism and trade. And the tourism industry is really important, about 10% of the economy. And trade, well, you know, buccaneering entrepreneurs was what I called Gibraltarian tradesmen. And they went all over the world. And lots of trade, and they were sitting on the edge of the EU without technically being part of a common trade area. So there was lots and lots of potential there. And so I said, China is so far away. We're in Gibraltar. Why? And lo and behold, when it came to shutting the frontier, which is to certain travellers, and we followed the UK in that, they went for Wuhan, I think, in the UK, and we went for China because Wuhan was so narrow. So we stopped people from China. I thought that would be a rare thing, but then we discovered there were about 1,100 visitors coming to Gibraltar every month, which was not inconsiderable.
From China?
Yes, and the reason for that is because the cost of visas was so high to go to the UK. People often finished off their tour of Europe by ending up next to a GPO post office box, a red post office with a British bobby to say they had been to the UK as well. So we got a lot of, it's also part of the Schengen area. So a lot of people could get in visa-free travel and they would pop in. And in fact, a week after we'd shut this, or we were considering shutting this, the Wuhan football team made a visit. I kid you not. Of all the places in the world, we had the Wuhan football team walking down the high street, which is called Main Street. And people were saying, my God, did you notice these people wandering around? Some of them had masks and some of them hadn't. They had some football matches arranged. So it became very apparent to us that because of the way that we traded in Gibraltar, and we had a lot of, the other main trade is crew changes, because it's a port, an awful lot of ships, crews change, and often they're Indian, Bangladeshi, Filipinos, and again, they have to go through visas. And because they were coming into the port and we had visa-free travel, they would get in and get a new crew and they could fly directly out to London from Gibraltar Airport. So, Gibraltar thrived on being the hub of international travel in a way that I hadn't ever appreciated when it was unknown to me. So we quickly escalated a lot of our concerns. We started to have emergency meetings, equivalent of COBRA, if you like. We continued to have them with my minister, and my minister, who is actually had a PhD in a biological PhD. I don't want to get it wrong. John Curtis, and he began to escalate it upwards to cabinet to say there was, the figures were coming back almost every day, and they were escalating, and people were getting more and more alarmed. So we then eventually managed to get one or two of our meetings chaired by the chief minister, the prime minister equivalent in Gibraltar. And I've got to say, the main focus of Gibraltar was preparing for Brexit. What's this thing coming in from the side? And I think gradually and eventually I was helped by some of the stuff that the WHO did release. So the WHO said it was a public health emergency of international concern on the 31st of January. It then issued other figures saying that the case fatality rate was 3.4%. And I made the case quite publicly. I said, can anyone tell me how in a densely packed area, Gibraltar is only about 2 square miles. But
it's all kind of around the edge, isn't it? Round about the huge rock.
60% of it's a big rock. So anyone who lives in high-rise flats, mostly around the edge. And I said, can anyone tell me why it would not spread? At that time, there was one of these cruise ships was holed up, I think, in Japan at the time. I said,
the Diamond Princess.
That's the one. So can anyone tell me why, if it arrived here in Gibraltar, it wouldn't spread like we're a cruise ship on land, I said. So can anyone tell me why we wouldn't suddenly have it spread throughout the entire population? No one could answer that. So I said a 3% mortality rate. Even if we take the best case scenario of 1%, which is eventually what it settled down to, I said we're looking at between 300 and 1,000 deaths. And I've got to say, in fact, I think the chief minister said openly that was his moment of complete fear. I think he called it his brown pants moment. And I did that presentation and then the whole of the political class. And I was lucky because I had every single person, I think, in the cabinet had been to university and understood what that meant, and about half the cabinet was actually solicitors who also valued the expertise of experts because they used that. And I was blessed, I think, with the Chief Minister, Fabian Picardo, who was an avid reader and hugely curious about this thing, and he read voluminously about it. And so it wasn't as much potentially of a challenge. I've got to say, I worried that we would do some of the actions because they would have catastrophic economic impact.
Yes.
But they did. You know, the whole thing about shutting down tourism, even though tourism went down of its own accord, that was a hugely problematic issue. Because I was single-handed, so I'm a single-handed director of public health.
So you were the public health authority in Gibraltar.
That's it.
You were it. Yeah.
That's it. So I was asked by everybody. So the ports came to me and said, "What do we have to do to be safe?" The church came to me. What do we have to do to have safe services? The High Court came to me. The Football Association came to me. So I saw all aspects of life in Gibraltar, and I was grateful, John, for some of the things you were putting on at the time, because that assisted me enormously. Because some of you. I think I've got to give you credit that actually I did use and utilize and watched avidly, and in fact sometimes I sent links from your talks to politicians because they were very cogent and coherent, sometimes critiques of the literature as well as descriptors of it. So it helped, and so one of the moments, for example, was masks, where I followed the WHO guidance and advice, and then gradually, I think towards April, I took a slightly different view. So we went into lockdown on March the 22nd, but we were in a social lockdown about a week before that because of what's happening across the frontier, and Madrid, pictures of bodies piling up, trolleys piling up. All of that was dreadful.
I remember that,
So actually we tried to keep the schools open because I said, look, this is not the flu. There wasn't a flu pandemic plan. I said, let's not get misdirected. This is not the flu. It's not going to affect children. Let's keep our schools open at that time. It's our older folk. That's what the evidence is. It's 70 and over that are coming in. But parents didn't want to send their children to school. We paid provision for free school meals, and I think there was only a few dozen children that turned up to take advantage of them. Parents stayed at home. They were terrified. They didn't know what this was, like a lot of places all over the world. But we then went into formal lockdown, and because the advice I had given was that 70 and overs, we actually enacted a law. I think it's probably the only one in the world that said it was not legal for 70-year-olds to go out except for very defined purposes, exercise, shopping, etc. And obviously the most compliant population is the over 60s when it comes to law. And I think we saved an awful lot of lives as a result of it.
It's really quite impressive. So basically you had a very proactive approach, you starting meetings in January, really early on. To have more scientists and doctors in politics. So you were lucky you had a few scientists. We need nurses, doctors, scientists, engineers, and mathematicians in politics, but that's a slightly separate issue. But the point is that from your medical side and the political side, you are integrating and working together harmoniously, and it sounds like they were taking your advice pretty well 100%.
Yes, Brexit helped. Because we were preparing for Brexit, the machinery of government was actually all geared towards resolving that conundrum. So when actually there was another threat to society, then that machinery turned over and said, so what do you want us to do? And it was working from home, and it was the advice I was giving, because there was no other alternative source of advice. I mean, it was a privileged time. There wasn't this more laterally, there's a much more contentious and competitive environment where we've got armchair epidemiologists and experts that are coming up with their own views. And actually my government at the time brought in experts from outside. So we had a weekly conference call with Professor Heyman, David Heyman, who wrote the book on communicable disease control, the reference book, and he was the chair of the WHO committee, the equivalent of the Specialist Advisory Group on Infections. And in fact, he was impressed. He encouraged us to talk to as many people as we could, and I did a presentation with Professor Cortez to the WHO committee to show what we'd done. We did not get one death till October, and then we only had that one lockdown where we had no deaths, and then we had our second lockdown at roughly the same time as they had it in the UK, which I think was the 2nd of January 2021 was our second lockdown. And we've only had 2 lockdowns. We had a very normal July and June, July and August. Tourists were coming from Seville to experience what it felt like to be normal.
Sure,
People were going, yes, they were wearing masks, because one of the things that I had been a convert to, the evidence that you had produced, the evidence that was finding up, was it was airborne. I remember being challenged by the Minister for Health saying, are you sure it's airborne? Because no one else is saying that. I said, look, it appears so. And in fact, I announced it at a press conference, which rather, I think, took everyone a little bit by shock.
And at the time, the WHO was overtly saying it's not airborne as in paratroopers, but it was clearly droplet and aerosolization of the infection, even at that early stage.
Yes, evidence-based. The things we did, we set up a Nightingale Hospital.
Yeah.
That was done, I think, late March. And again, lots of entrepreneurs. We set it up in 4 or 5 days with an oxygen supply.
Impressive.
We cleared our hospital, but instead of we only have one nursing home. It's got 300 beds in it. The hospital in Gibraltar has only got roughly about 200 beds in it, so it's bigger than the hospital itself. And one of the things we agreed was that nobody would be decanted from the residential nursing home to the hospital. In fact, we converted the residential nursing home into a care of the elderly hospital, a geriatric hospital, which had its own clinical teams, its own nurses, and they would they would do heroic work to keep people alive, including CPAP and everything else.
And that's what caused so many deaths in the UK, people going from hospital into nursing homes and vice versa. Yes. And you'd actually segregated the 2 sectors.
Because we'd done it in February, we didn't have an infection, so people were decanted into the.
That's impressive.
We hit problems, so we set up our own public health lab from scratch. We had no ability, like a lot of places, to test. I had to fly things over to West London, and British Airways had its laws about how, and regulations about how things must be packaged. So we were doing things blind for a long time, but all credit to the people of Gibraltar and the government of Gibraltar. They put together these things that you would not imagine could be done in less than a week.
So when you say blind, but it's not really blind. You were using your medical and public health experience to extrapolate, in a sense, to this situation. You're applying principles. I mean, Koch's postulates are Koch's postulates, aren't they? There's all these principles that we can apply. But you were also, and this is I think a few doctors around the world did that. But the big thing is that you were able to unify with the politicians, who unified with the people, and you sort of move forward in a medically scientifically correct, coordinated way as a population. And setting these things up so quickly and proactively really is quite impressive. And as you've said, you had no deaths until October. It's quite something.
Unfortunately, at that point, as I said, we had a normal summer. So at that point, there was a lot of agitation by people, distressed relatives who wanted to see their mum and dad. And, I've got a lot of sympathy for that. But that meant there were cases coming in, and there was a case or 2 that managed to get into. And of course, I'm not diminishing. We also set up a contact tracing function from scratch. I wasn't dependent on Public Health England. I did have a bit of help from a locum consultant that came in to help set that up. And we set up our own reporting system as well. And as you'll have known, John, we had the highest swabbing rate in the world per capita for a long time.
Yes.
Because that was the only way then we could know what was going on in a very dense population where people have the habit of kissing and cuddling.
Yeah.
Very, very Mediterranean in the way they express themselves. And I had to ban all of that. You can imagine.
Yeah. Yeah. You're going against the culture.
Not popular. And, coming by October, November, when no one had died, and everyone was beginning to believe this was a lot of fuss over nothing. But we had cleared a hospital of everything. Our surgeons went home because there was no routine care that was to be provided. We were ready for that tsunami of cases that we saw. We didn't want people lying in corridors, and nothing happened. Even a road traffic accident stopped. No one was falling ill or coming in. Our average A&E attendance figures went down 90%. So we had an empty hospital, a full hospital for the elderly, and we had transformed our society in preparation for this, and then nothing happened. And I think a lot of people then believed that there was a lot of fuss over nothing. So they wanted to go back to normal. And at that point, unfortunately, we got about, I think it was a few dozen cases in the residential care of the elderly, and the geriatric team there under the consultant there. They fought heroically in separating out people. These are very close circumstances. The advantage of the Mediterranean climate, however, is you can open the windows and doors.
Indeed. Yeah.
So there was that, but they did a fair amount of segregation, and unfortunately we lost 5 people at that time, which is, given that the average age in the ERS, we call it elderly residential services, that was a toll that we would have done without. But I think what really created problems for us was what we've experienced in the UK around Christmas, and we're going to go through it again, is that people want to celebrate. It's and I went on TV. I was a regular on TV, I've got to say, but I went on TV beseeching people. I said if it was in my power, I wished to push Christmas to June. And I said, do what you can to socially distance, open your doors and windows, go for smaller events. I got invited to 3 Christmas parties myself, even though I'd given that advice. Obviously, I didn't go.
I take it you didn't go to set a good example. Yeah.
Of course. I was well aware of chief medical officers that had suffered the consequences.
We have seen a few of those, absolutely.
Absolutely. No, I followed and endeavoured to follow my example, as did the politicians of all hues. This is not just the leading party, but the opposition too. And unfortunately, they did not abide by it. There were an awful lot of issues. We realised that there were problems because people realised that there were traditional ways to celebrate the New Year, with welcoming in with people in drinks, etc. And we thought alcohol would be a problem. And so we actually banned the alcohol drinking out in the streets.
Right, yeah.
And unfortunately, it was all too late. So we had to have another lockdown on the 2nd of January.
2nd of January, right, yeah.
Yeah,
and then there was a lot of cases after that.
Absolutely. And but we didn't get our vaccine till about, I think, January the 8th. I was, I think, one of the first people to get vaccinated, because surveys had been done by the local paper in June, July, August, and it found it was only an online survey of their readers, but 46% of people were saying they weren't going to get vaccinated. So there's a lot of vaccine hesitancy. Because it's a social culture, people listen to rumours, etc., etc. So, we had to go out there just like they did everywhere else in the world and get jabbed. And Chief Minister got jabbed, and Minister for Health got jabbed, etc. And we followed the protocol at that time, which was a 3-week gap. We went out and got And the other big issue in Gibraltar, as you mentioned before, is what we call cross-frontier workers in Gibraltar, basically people who live outside. Gibraltar is very expensive if you don't work in, if you live in Gibraltar. It's very expensive. I would say the prices are about 30% higher than they are in the UK for just normal victuals. So there's an awful lot of people who choose to live across the border and come to work. And there are people on the poorer end of the scale who do cleaning and security, delivery services. And so that was where the deliberate decision was made to help provide support for them. We're protecting our own population, actually, if we provide coverage for them. There are all sorts of issues about registration. In order to gain access to healthcare, you need to be registered to be accessible to GHA, Gibraltar Health Authority, and we had to change a lot of the rules around eligibility. So that's why we hit a very high mark very quickly because of that social infrastructure. But there were a cohort of people who didn't want vaccinated. So again, we had the highest rate of vaccination.
It was a high rate, plus about 15,000 workers from Spain, is it? 10, 15,000 workers, Yes,
so double vaccinated. And the problem, I think, latterly, as I was leaving, the problem was that vaccine memory was failing because we had only had a 3-week gap. So more people were beginning to have that waning immunity. And the other thing that was delayed was children's vaccination. No real planning or political reason for it. I think there was clarity that with the advice coming from these trials was that it was perfectly reasonable to give 12 to 15-year-olds. We did, by the way, vaccinate 17-year-olds and 18-year-olds as part of our normal cohort. But this group that was left behind has actually created a fair amount of ability of transmission and transmission across generations, because parents have to work, and as parents have to work, they have to leave their children with their parents, their grandparents, who were of the wrong age denomination.
Absolutely. Was it mostly Pfizer vaccine from memory in Gibraltar?
So the only
and they came straight from the UK, did they?
And they were flown in by the UK government. They had been procured on our behalf, and then the UK government was responsible for the distribution across. I mean, clearly they couldn't give out the Pfizer to some of the further away places like the Falklands. So they I think, got other ones because of the
cold chain.
Time, the transportation was a significant issue. And I remember us coming out of the whole experience, and people wanted to challenge the edges of what was acceptable. So I had the ordination of an archbishop, the first one to deal with. I had a world heavyweight boxing match. I had a FIFA match, and I had to come up in first principles. How would we manage that safely? I believe we had the first football match where the entire all spectators were double vaccinated. And I'm trying to remember. I think it was the match after Gibraltar played Norway. I think they played Holland. So the entire audience was double vaccinated.
So you kind of worked out all these strategies. There's no chapter to look up in the textbook.
Exactly.
You just had to apply your first principles to working all this out. Yeah.
Yes.
So cases went up. Just remind us, it's quite January, February, were they the worst sort of times for cases in Gibraltar?
Indeed. I mean, it went literally from 20 a day to 125 the next day. I mean, to say we were overwhelmed, it would be not to exaggerate.
How did the hospital cope?
So these cases were just people who were. I remember there's always a delay of 10, 14 days at the very least. And actually, we had dedicated COVID wards. Victoria Ward, for example. ICU was put under quite a lot of pressure. And one of the things the government did do was go out and try to recruit staff from the UK agencies. I think through the generosity of some patrons, they made a plane available, and we brought a plane in. where people were flown in to provide it, but people were dog tired, just like everywhere else. People were exhausted, so I would say that because we had 200 beds, so in total, the number of hospitalized patients in Gibraltar is less than 300. So we had more than enough capacity in terms of beds. Our biggest problem was staff. Right. Yeah. Yeah. And you can't suddenly grow a whole bunch of respiratory physicians out of nowhere, or more A&E staff or ITU. In fact, we ran courses to try to do some fairly basic emergency care for some additional nurses, so some really heroic stuff. And as I said, Brexit was a saving grace, because one of the things that we had was a Brexit supply of PPE. What we didn't have was a Brexit supply of extra beds and ventilators. We've got oxygen concentrators. I still have nightmares sometimes of a tanker, of a container ship turning up with 4,000 ventilators, because we'd ordered so many from all over the world. So, but that whole thing, that whole experience showed that when people pull together to a common purpose, heroic things can be achieved.
Indeed. I mean, at this time you were a public health consultant, but am I also right in thinking you were chief medical officer for Gibraltar at the same time as well?
Yes, yes.
So all these medical services came under your umbrella as well as the public health?
Well, certainly I was providing the medical leadership around that. And I've got to say, in the early stages, when I did bring this rather unwelcome news that this tsunami of cases might be coming, and if we use the prevalence of 1%, then it could be up to 300 fatalities. This was not welcomed, because remember, Gibraltar is a sunny place not far from the Costa del Sol, where an awful lot of people come to retire, to have a quiet life. It's not necessarily at the cutting edge of, you don't go to Gibraltar to fight the good fight, largely. So, a lot of people felt that challenging. Suddenly here was reality coming to knock on their door. But, again, I've got to take my hats off. Colleagues pulled together. They asked, what is it that we should do? They learnt from the experiences in England, which was ahead when it came to care, because they had suffered the catastrophe we hadn't. I think, and I pulled together a research group. Again, there were all sorts of people who had, Gibraltar had invested, its history had been of people investing in education. So I got people who had degrees in maths, PhDs, and all sorts. We put together a research group, and we actually did some of our own modelling, having to do, and it was checked by the MOD, who didn't disagree with us. So for a small place,
it's really impressive. Yeah, it really is impressive.
It's got a lot of depth, and it's, as I said, it was a privilege to be there to help support those heroic efforts. So I think the Medallion of Honor is a reflection of all the hard work that everybody did.
Do you have it there, Sohail? I'd love to see it.
I do have it, but I'll have to.
Don't worry, it's okay. No, it's great. No one's ever given me an honour, so that's it's impressive. But so. I mean, the only thing that's confusing me is, when did you sleep in January, February?
Actually, funny enough, the busiest, I did a diary audit, and the busiest times for me were March, April, May of 2020.
Right.
Because
all the setting up at the beginning,
preparing all the grounds. So I was doing an average of about 96 hours a week after that period. But before that period, I was doing, I think some weeks I was doing 158 hours, judging by my outgoing calls and the outgoing emails. So I was not sleeping.
How is that possible? You must have been totally exhausted.
I was. Adrenaline is, and you catnapped. I didn't even have time to eat, to be fair. People would bring me food and say, you've not eaten anything. And it was that dire. at the time, but there was no one else. There wasn't anyone else I could certainly get.
Yeah. And then sort of, when did cases start to die down a bit after that in 2021?
So 2021, what we did was I used, again, the basic epidemiology around this. And I said that we got double vaccinated. So we actually had Freedom Day. We called it Freedom Day too. March, I think it was March the 14th or 15th was Freedom Day for us. But at that point, we actually then said that we would go back to more normal. But what we didn't do, and what I was keen to not do, was to remove the mask mandate. So I said, as has happened in other countries, you are expected to wear a mask in public transport, in a taxi, in a hospital, and in enclosed public spaces. Compliance was higher, but still going away. People got COVID fatigued out of it.
Everyone just sick of it, weren't they? Yeah, absolutely.
Absolutely. I also said that close contacts of positive cases, our picture was about 60 to 70% of cases were people who had it. I mean, it was Delta at that time, but people who were in the same household. So it meant that, clearly people who were in the same house should remain for the 10 days. So we did not allow them out. That created problems for a small economy such as Gibraltar, because it meant that we lost more services because parents were looking after their children, and that had an impact on sickness absence. So with the vaccination, I relented. So remember, we're trying to persuade people that vaccines are important in the face of vaccine hesitancy. And we had to give some encouragement for people to take the vaccines. So we said, if you're double vaccinated, 2 weeks after you're double vaccinated, you can go out and go to work. However, because vaccination does not mean that you cannot transmit, you will have to wear a mask when you go out. And if you want to eat, you need to do so alone, preferably outside. So you're not transmitting it to anyone else. If you go shopping, you can go shopping, but you need to wear a mask. Of course, you had to wear a mask anyway. The only time you didn't need to wear a mask were when you were socially distanced out for exercise from everywhere else. So another big thing was gyms and all the physical activities. There's quite a strong industry, even in the UK, where young people want to be fit and they sweat. And they say, why should I wear a mask? And there was an awful lot of contestability. Should I wear a mask? Shouldn't I wear a mask? It's ridiculous, etc. So I had to hold a strict line. In fact, one of the things I was asked to do was issue exemptions from masks. And I said and undertook that this should be on a named person basis. And it would be, I took the view that not wearing a mask was almost tantamount to me as a medical professional giving someone who had expressed a desire to end their life, giving them a rope or giving them a bottle of paracetamol. I thought it wasn't really ethically wise to do so. So I resisted, and we created, and there was a lot of distressed people, and for them, I gave them that get out clause, but I explained to them that they then had to sign something saying that they understood the risk, they took it upon themselves, that they took that risk, and that they understood that insurance companies might not insure them if they took some of those risks, because my view was that the mask was there for protecting them and to protect the public. So that's what we did, and I think the temperature also going up and people going outdoors suppressed it. And I think when schools went back, and we tried to release it as much as possible. I was really keen to say that education would last a lifetime and we could affect their social development. But again, the schools cooperated hugely in trying to maintain distance and cleanliness as much as possible.
So cases, as a result of all these measures, cases were pretty low, sort of April, May, June, July, pretty low in summer. It must have been quite disappointing that cases started to pick up again after such a high proportion of, I mean, what proportion of the population were vaccinated? It was one of the highest in Europe, or is that the highest in Europe, I think?
I think it's the highest in the world. It's 140% or something, isn't it?
That's right. It's actually way. Oh, yeah, that's right. Yeah, it is. In fact, it is 140%. I remember that now. Yeah. So it must have been a bit disappointing when you started to see cases starting to trickle back into the statistics in the last sort of 2-3 months, I'm guessing.
Yes. So I had more of an observer role because that sort of I had accrued I think 85 days of leave.
Right.
Contract.
Yeah, you'd have no holiday for basically 18 months. Yeah.
Yes, absolutely.
Yeah.
So I watched that, but one of the things that was clear to me was children between 12 to 15 would be vectors. They would transmit, and therefore having them vaccinated was really quite important. I was puzzled. So the JCVI took a view that the evidence hadn't been gathered. And I think that illustrated that the JCVI is not fit for purpose in an epidemic. In an epidemic, you need experiential people who, based on their knowledge and experience, can act. You can't wait for the evidence to accumulate. And I think that was perhaps it wasn't a problem for Gibraltar because we didn't need to abide by the JCVI, but obviously the supply of vaccine was being controlled by the UK government.
Yeah, so, I mean, we basically need proactivity, don't we? That's the whole point. Yeah.
I said again and again, I said this vaccine, this virus is 10 days to 14 days ahead of where we think it is.
Yeah.
So the best information we have is always at a date because the incubation period is going on. So even though someone may be negative, they will take 10 days to convert. And therefore, the virus is always ahead. We've got to plan. One of the biggest challenges for me was saying to the politicians, don't act on the basis of information you got now, act on the trend and act on where the virus will be. And this is a tricky virus. I called it the trickster virus, actually.
Right.
It did do things that were entirely unexpected. And you know, we know that the way the virus reacts, attacks the endothelium, etc. So I continue to feel worried about chronic COVID. Since I've got, I lived through another pandemic, the HIV pandemic, as you did.
Indeed.
And you know, it was a minor illness at the start, and it was only because it damaged the immune system that we discovered all the long-term effects that AIDS brought. So I worry that any virus that affects the immune system may have longer-term consequences. And certainly we did pick up about 10% of people a month after having COVID were having profound tiredness, weakness, you know, marathon runners not being able to get out of bed. So I continue to remain worried about the long-term consequences. You've highlighted where there's been damage taking place to neurons, olfactory and hearing cells as well. So there's a lot we don't know about this virus.
There is a lot still to come, I suspect. What I've been reassured about in Gibraltar, though, is that although the cases have increased recently, the death rate is mercifully very, very low. I think from memory, we're dealing with about 4 deaths over the past 4 months or so. So, I mean, it seems clear to me that the protective effect of the vaccines, even though Gibraltar vaccinated with a short time interval and very early, that the protective effect against severe illness, hospitalisation and death is lasting much longer than the protective effect against testing positive and against minimally symptomatic disease.
I think there's the proof there that vaccination does work. Absolutely. The current disease, the current infections in very young people, and we know that they don't really suffer rapid consequences, and the older people actually also have the protection from the vaccine. One other thing I should say is that one of the things that we did do was set up a medical examiner system in an emergency, you know, again in a week like we did.
It's amazing.
What that means was that every death, we didn't want to hold up people who had died being buried, because it's a Mediterranean culture. People will know that people get they get interred, buried within almost 4 hours of dying sometimes. And so we had a system where we would expedite. We had a doctor, two in fact, who would discuss the case, look at the samples, look at the history. We also tested everyone throat swab that had passed on. So we were pretty sure that we knew people who had died from COVID or with COVID.
Interesting. I don't think we've ever done testing of people who have died.
Yes.
Post-mortem testing in the UK. I've never heard of that before.
No,
That's
so
interesting.
throat swab. Well, our funeral directors refused to process the bodies, so we had to cut at least one way. So we had to double bag them, and we had to show them that there wasn't, that we knew who had COVID or who didn't have COVID. And obviously, people who died in the ERS, we already know they had COVID, so we would double bag them. But if there was anyone else, the bodies would only be processed once we'd got a negative throat swab.
Just out of interest, Sohail, how long would the PCR test stay positive for? Some time after death, I'm guessing. The viral fragments would still be there for some time.
Absolutely. I think the sensitivity of it, and again, one of the other innovative things we did was we used the loop method, the LAMP method, which I know was pioneered by one of our microbiologists in Basingstoke, Dr. Nick Cortez did that, and he was able to bring that technique over, and we were able to use it. So it's got a very rapid response. So we were reporting on the same day, usually within 8 hours of any positive test, and we did thousands. Tens of thousands of them. So we automated that in our public health lab, but it also meant that we were able to assure people and process them as rapidly as possible when they had died. And it threw challenges up, of course, when they were positive. So both the Jewish and Muslim communities have particular rituals they have to go through, the washing the bodies, that meant there was disposal. So there's all sorts of challenges. There's layers within layers. The great advantage of a small place like Gibraltar, it's much more apparent. You can see it being developed, whereas in a large conurbation, you only ever see one tiny component of it.
That's right. Interesting. Yeah, but I mean, in terms of care of the deceased, I mean, as long as, to put it quite crudely, dead people don't breathe, so there wouldn't be aerosolization of the virus. So I would assume the risk is reasonably low.
It is. That's what we said to the funeral directors, and they refused point blank.
Right.
To accept it. I mean, as exactly the same terms I said with you. Dead men don't breathe, so why are you frightened of? And it took a long while for the courage to build up. The other thing that happens in terms of Christian burials, there they do the Spanish one of burying people in niches. So these are like high-rise blocks where you put them in. The bodies are then interred a year later and then put into their the family plot. So the double bagging was also necessary because of liquefaction after death. I mean, they're a bit yucky things, but that shows you the kind of things one had to get involved with.
Indeed, yeah. I remember actually being approached by undertakers locally myself, and I thought the biggest risk at the time was someone who died in a room. If the undertakers are coming within an hour or two, there's still going to be a lot of virus present in the air. So the immediate advice was ask the relatives to open the windows and get the air as fresh as we could, which of course is a very old nursing tradition that you open the window when someone dies anyway, for a very old tradition reason. Right. That is a fascinating timeline, and I really wanted to document that here because I've had so many questions about Gibraltar. Often in a very challenging way. People are trying to use Gibraltar because it's this interesting microcosm, and they try to use it to support their own particular position. So to get a definitive history from the Director of Public Health in Gibraltar really is, I think that's a really important document we've actually recorded there, and hopefully people will look back at this in the future and benefit from it. A couple of quick questions I've got for you. Is there a sunbathing culture in Gibraltar?
Yes. There's a huge sunbathing culture. As I said, people were coming from Seville in July and August to sit on the beach. The beaches are tiny, so unfortunately, people almost inherit their patch of beach.
Yes.
And they don't look kindly on other people sitting on their patches. But yes, there are summer hours. So the culture of Gibraltar is that in the summer, most workforce, the non-clinical workforce, will go at 2 o'clock. So they'll start at 8 and they'll go at 2 and rush for the beach.
Yeah. So we can assume that the vitamin D levels are fairly good throughout the summer months.
Yes.
And do you think that's important in terms of immunoprotection and immunomodulation?
I've seen some of your presentations, right? I think it seems.
Feel free to disagree. It's
no, it's someone with darker skin. I certainly do the value of vitamin D, absolutely. And we don't really have many people who are vitamin D deficient. Obviously, they've got other conditions that are going on. So yeah. I think
surprisingly in Spain there is quite a fairly high prevalence of vitamin D deficiency for cultural reasons, presumably.
Yes. Yeah, there are also all sorts of other reasons why they might be vitamin D deficient. Yeah, it's. We did debate, and in fact, I think we did go out and buy a stock of vitamin D.
Interesting.
On the basis of actually distributing to the population. I don't know if it actually ever happened, but we did buy a stock of vitamin D, as we bought a stock of other drugs as well, partly as a result of the knowledge that was being spread around. Some of it was misinformation.
So I take it you're taking some vitamin D now. You're working in sunny England in November, late November.
Yeah, well, actually, I've got a load of supplements I take, but actually thinking about it, yeah, I think I need to go and get some. I'm planning to go back to Gib next for a break, but yeah.
Oh, fantastic!
I normally do take vitamin D.
Good, delighted to hear it. The other thing now that we were talking about that the evidence is just emerging on from some German scientists is taking vitamin K2 with it, because vitamin K2 tends to make the calcium that can be released if you take large amounts of vitamin D, puts it into the bones as opposed to puts it into the soft tissue. So that's another interesting area that we're sort of keeping an eye on. And vitamin K normally comes from grass-fed animals and fermented foods, which we tend not to eat. Yes. Very much of it in an English culture. So
dairy used to be a good way to acquire, wasn't it? Dairy food, butter, cheeses and things like that. And as people have moved away from it, I think they add it to margarine.
Yeah, then it depends what you feed the cows on.
Yes,
for the vitamin K, because the bacterial.
Yeah.
Now, another one of my pet projects is aspiration of vaccination.
Yes.
Where would you come in on aspiration? Do you think it does any harm, or do you think it's something that we could do to try and eliminate a potential variable, or where are you with that one?
So, I mean, I'm with you, John. I think there's a degree of credibility around the mechanism, and it would add, maybe 5 seconds to 4 seconds to. Yeah. It doesn't add anything in terms of the delay that there would be in doing it. So what harm can it possibly do? So I think there's a credibility to it. I myself did suffer when I got COVID. I got palpitations and things like that. So you wonder if you inject something into people directly into a blood vessel, whether that might not cause a bit more exaggerated effect.
I don't think we mentioned that. You actually had the infection yourself, Sohail, did you? When?
Yeah, I was about the third person in Gibraltar to get it.
Yeah, right. I don't think we mentioned that, right? So we're talking what, February, March, April?
Yeah, early March. I'd just been to the UK and picked up a sore throat and went back, and my sample had to go to London. So it wasn't until about 5 or 6 days later, and I was actually out of the incubation isolation period. At that time, I think Public Health England was advising 7 days of isolation. We had gone to a 10-day isolation period roughly about then. So we were just asking people to isolate for 10 days. So I was out the isolation period almost as soon as I found out. And, sore throat, and I think my taste and smell went. And I did get some palpitations for a while afterwards and not being able to sleep. But then that was quite helpful. You asked me the question, how did I thrive on having no sleep? Maybe it was the COVID that had kept me going from not having any sleep.
The palpitations must have been quite disconcerting. Did you go dizzy with it, or was it just a feeling in your chest?
No, there were excessive ectopics, I think, at the time. But It wasn't in any way, frankly, pathological. I think what I found, and it may be anxiety, because that's the other thing, when you see a tsunami coming. So, lying or lying in bed or dozing and then suddenly waking up with your heart racing. Maybe I'm now in retrospect saying it was pathological, but at the time I just put it down to anxiety, not having a healthy diet, having too much caffeine to drink because you needed to have coffee and tea to keep yourself awake.
Did you have your own GP in Gibraltar? You had a doctor you could see yourself personally?
I could, but to be fair, I think I did. I wasn't short of people who were willing to act as advisors, but I didn't have the time to do
it. Indeed, yeah. Anyway, how are you now?
Well, I'm working, as you said, for Slough in helping them corral their response now that we've got this Omicron virus. Its variant. I do hope that will make people sit up and take note again, because I'm facing an awful lot of COVID, not just fatigue, it's antipathy. It's not just apathy, it's antipathy.
Yeah, they're actually against it,
People don't want to hear, they want it over and done with. And do you know what? Yeah. I've lived for 18 months or more with it, 2 years, and I'm fed up too.
Absolutely,
Why would I want it anymore? But I have a job to alert people to this risk to life, limb, and the future. And it would be negligent if I didn't use all my powers to say to people. But I find it difficult, even when I'm giving people medical advice, that there isn't actually, people don't want to hear it. It's a bit like that lifestyle advice that doctors give out. Oh, you must lose weight, you must exercise more. Yeah, doc, give me a tablet.
Yeah, but I like drinking.
Yes, exactly. So I think it's got to that stage where people say, yeah. But the fear is still there, actually. So I think if we do start to see people succumbing either unusually or unexpectedly, I think it wouldn't take much for people to say, God, the nightmare is back. But usually pandemics in the books usually last 3 years, 4 years sometimes. So I kept telling people we're only halfway through. And clearly one of the ways that none of us are free from the pandemic until all of us are free from the pandemic. And that's one of the lessons that the virus has taught us. Just like it's taught us about health inequalities, it's teaching us we're one human race.
As if the Omicron variant needed to come along to remind us of that obvious truth. But it has. It's reminded us by hitting us between the eyes with it again now, hasn't it? It's
the trouble with populist politicians, I'm afraid, is that populist politicians say what is popular, and what is popular is it's over and done with. Let's get back to normal. This is a relentless predator. It's a relentless predator that seeks prey, and we have lots of weaknesses. And one of those weaknesses is places with either poor healthcare or lots of people with suppressed immunity. So in South Africa, for example, there's a large belief that you didn't need to medicate to deal with HIV infections. And I wonder whether this whole Omicron, with its multiple mutations, may have arisen in someone with suppressed immunity. Clearly it has.
It's clearly one of the leading theories, isn't it? Someone with HIV, where the virus could actually evolve within an individual over a period of potentially months.
Yes, and we did have people in ITU that got infected twice. So it does happen.
Yeah, that's brilliant. Just very briefly, your current job now, Slough is not an area without challenges, is it? It's very, very high ethnicity population in Slough, I believe.
Yeah, it's about 60% South Asian heritage, about 20% are Eastern European, Polish and Romanian. I think they're more Roma community. and it's a bit of inner London put out into rural Berkshire. A lot of health inequalities, lots of high multi-generational households living in overcrowded houses. And that's what appealed to me when I went for the job. Unfortunately, it's also had some financial difficulties, and the local authority has issued a Section 114 notice, which is a fancy way of local government saying we're bankrupt. So, so it hasn't. There's a lot of very good people in Slough. Again, it's great to work with such great, inspiring people, but they haven't got their troubles to seek. And it's a place of enduring transmission. And one of the reasons for the enduring transmission, I think, has been the way that the contact tracing system isn't responsive. It waits for the national system to tell it, and it is about 2 or 3 days delay. So we're going to sort that out. We're in the process of sorting that out. And the other one is the whole multi-generational antipathy. And the commonest thing that we hear, and I know other people say it, the vaccine was developed too fast. There's something fishy going on about it. These things don't normally happen that quickly, and then you have to talk them through how medication and how it develops, and you throw money at it, and you get everybody wanting to push in a common direction. Then you have fast development. But,
so shall we say you've come to work in one of the more interesting parts of the United Kingdom?
Absolutely. And one of the things you have when you've done 30 years or more of public health is that you've done an awful lot of the stuff that most people aspire to do. So I'm now interested in things that are a little bit more challenging. Let's put it that way.
Well, indeed, and it's good to know that because of your experience and the way you've applied that to the situation, there's a lot of people walking around alive now who otherwise wouldn't have been. And
thank you.
It's an impressive story. Yeah,
but the thing in England that I've recognised is that there's still a sort of hierarchical arrangement. So as a doctor, as a GMC registered doctor, I as a consultant, I would expect to be able to make decisions autonomously on behalf of my population. That doesn't seem to be that clearly defined in the system as it's constructed in England. I think that there's a sort of tendency for people to go and do things because everyone else is doing things, or because someone higher up in the hierarchy is told them. I think that's partly due to hesitancy and lack of confidence, because public health has changed from a medical profession into a predominantly non-medical professional led group. There's still medics around, such as myself, but I think that also means that people aren't necessarily as confident about these medical factors, and it's easier to quote a medic or a chief medical officer than it is to think for yourself. So I think that's probably something that has been lost as my specialty became, and I'm for it. Don't get me wrong. I think bringing people in with lots of other skills has been a very positive thing for my profession. But you've got to balance this against the loss that you have of people being able to think in terms of first principles. I said to my schools when I first came, for goodness sake, get your masks on. Why aren't you wearing masks? You should prepare, etc. And I was absolutely castigated because people wanted to get back to normal, and that was the prevailing view in England. We want to get back to normal. Don't tell us about the ghost of Christmas past. You're thinking of the bright, sunny uplands of the future that's been promised.
It's an interesting contrast, actually. Hospital consultants basically can do what they want pretty well, and they have a lot of autonomy, and I've seen that save many lives, of course. So, having worked in hospitals for on and off for 40 years, a lot of the time, and it sounds like in public health you are more constrained to the protocol rather than the individual medical the medical opinion. But I think one of the strengths that's come out through this story here is the way that you were able to use your expertise in the Gibraltar situation, less constrained perhaps by the rules of the hierarchy than you would be in the UK, and the positive benefits that has brought.
Yeah. Something for the review, certainly something for audit purposes, is what difference does it make to have everyone? There are advantages in everyone being aligned. It means that everyone knows there is one answer and that's the answer. But the disadvantages of that is the natural experiments that you can carry out.
Indeed, yeah.
You can't do, generally in public health, you can't do randomized controlled trials because there's too much variability. But this would have allowed some experiments to be tried like that in terms of modifying the social norms.
And different approaches between different areas of public health consultants. That would have been interesting. Sure. Just finish off by telling us what's going to happen with the Omicron variant, please, Sohail. Nice easy question to finish with.
Don't worry, I get asked to predict the future all the time, and I keep telling everyone nothing would please me more than to be wrong.
Absolutely,
if this virus actually followed the course as I think it will do, it looks like there's widespread community spread already.
Yeah.
I think that unless we take very strong direct action, it will spread through our population. It's yet unknown just which particular age group it will target. Remember, flu, the 1918 flu, in its last wave attacked the young with a hyperimmune response. I hope that doesn't happen, but we've got to be mindful of history. And so I think that we will have residual immune memory. A lot of us will have residual immune memory from, I've had my booster, I've had 3 doses of it, which I think is a standard vaccination.
Yeah, me too. Yeah.
Yeah. But how much will that protect people? And what appears to be is a dose response thing. The more virus that you're exposed to, the worse your potential prognosis is, in the sense that you could get pneumonia. Why do some people only get sore throats? Why do some get pneumonia? Why do some get sepsis throughout the body?
The inoculum, the physical, the sheer number of viral particles.
Exactly. So we don't know enough about what that is for this Omicron variant. I just remember that the difference between Delta and Alpha was orders of magnitude more virus around. Which helps its transmission. So I think that may well be the case with Omicron. So we will convert, I think, worldwide to the Omicron variant. The question mark is, how ill are we going to get? I would want us to vaccinate everyone we can. I would start with 5-year-olds on upwards and do it worldwide. I think we need to help support those people that haven't got vaccination. Again, vitamin D, I'm happy for people to be passed out with vitamin D tablets. I don't think it
absolutely. I've bunked up to 6,000 units a day.
But yes, in fact, you reminded me, that was the last shopping thing I did, was to try to find 6,000 units.
First thing Monday morning, please do that. Don't forget.
Yes, thank you.
We need good men, that's for sure. So absolutely fascinating. Really, really pleased to have kind of got that all canned in there, and I'm sure people will be combing through this for years to come, and I've certainly found it fascinating. And if you'd like to come back on at some point, tell us about your adventures in Slough or whatever.
I'm a coalface public health expert, so I've been fighting this thing for. So I think I've got a better sense of who my opponent is than most. Hence this relentless predator. This trickster virus, and the way it exposes our need as social creatures, and how we manage to con ourselves by everything. Communal prayer, communal funerals, communal parties, all these. That's what makes us human, and it goes for our Achilles heel. So I'm more than happy in future to have a discussion as a practical, hands-on kind of front-facing population physician.
Yeah, that'd be fantastic. Yeah. In the meantime, we've taken up most of your Saturday evening. We're very grateful, and thank you very much, Sohail, and congratulations on what you've done. It's just a fascinating story. It's just the way it should be. It's been great. Thank you.
Privilege talking to you as well.
Thank you. Thank you.
Thank you.